The Akwa Ibom COVID-19 Action Recovery and Economic Stimulus, AK CARES, is the Akwa Ibom State's response to the COVID-19 pandemic, which has caused significant devastation to the economies of micro, small, and medium-scale enterprises, livelihoods of the poor and vulnerable households, and businesses in the agricultural value chains. The Executive Governor of Akwa Ibom State, His Excellency, Mr. Udom Emmanuel, has led the charge to mitigate the impact of the pandemic on the state.
This information, sad as it is, did not meet us unprepared.
The Akwa Ibom CARES program was officially launched in Akwa Ibom State on Monday, the 29th day of August 2022 at Ibom Hall, IBB Avenue, Uyo, by His Excellency the Governor of Akwa Ibom State, represented by the Deputy Governor, Mr. Moses Ekpo. The Governor emphasized the need for the people of the state to embrace the program to help rebuild their lives and businesses and to stem the poverty caused by the pandemic.
I'm happy to welcome all of us to the inauguration of the Akwa Ibom COVID-19 Action Recovery and Economic Stimulus, AK CARES, Akwa Ibom CARES, all of us, organized by the Ministry of Economic Development. The Akwa Ibom COVID-19 Action Recovery and Economic Stimulus is a social intervention measure aimed at ameliorating the devastating effects of the COVID-19 pandemic on the living standards of Akwa Ibom people. It offers safety nets to those whose means of livelihood have been negatively affected by the impact of COVID-19 to rebuild their resilience against such future occurrences.
He also urged governmental bodies involved in the delivery of the program to ensure the success of the program.
We must all work together in seeing the total realization of this program and ameliorate the debilitating effects of COVID-19 and its awful impact on our social and economic development.
Mr. Bob, Commissioner for Economic Development and Chairman of the State Steering Committee of AK CARES, gave an overview of the program and charged beneficiaries to ensure effective use of the resources entrusted to them.
The AK program is an emergency program designed to urgently push and ameliorate the adverse effects of the COVID-19 pandemic on poor and vulnerable households in the state, using program for result delivery mechanisms to achieve the desired results. It is a short-term response to the economic and COVID-19 crisis affecting Nigeria and is designed to support budgeted government interventions at the state level, targeting existing and newly vulnerable and poor households, agricultural value chains, and micro and small enterprises affected by economic crisis.
Other members of the SCSC spoke of the high benefits of the program for the state and its people. The Honorable Commissioner for Agriculture, Dr. Mrs. Offiong-Ofo, appreciated the state governor for ensuring that farmers were beneficiaries of the AK CARES.
We appreciate His Excellency the Governor for his support, not only to the farmers, but to everyone that has been affected by COVID-19. When you see that acronym, AK CARES, beyond the fact that it represents COVID-19 action, response, economic stimulus, that is what CARES means, showing concern about a person's welfare. And His Excellency is a governor that cares. Can we put our hands together for our ever-caring governor? I appreciate it for the opportunity he has given farmers and other members of of the society to recover from the effects of COVID-19. Let me say here that farmers are the greatest benefactors of these AKKs.
As part of the official launching, 5 communities in the state, Obotongsie in Orofong-Oroko, Awaiman in Ona local government, Ekparakwa, Oroanam local government, Afaratai, Ibesbasutan local government, and Ntokwanoko in Isinudum, received checks of 13 million naira each for the provision of basic services in the health, education, nutrition, water and sanitation at the community level. Other beneficiaries were presented with agricultural inputs, while working tools were also showcased. The AKK Steering Committee was inaugurated by the Secretary to the State Government, Dr. Emmanuel Ekuwem, on behalf of His Excellency the Executive Governor on 29th June 2021. The Steering Committee has Mr. Mbab, the Honorable Commissioner, Ministry of Economic Development, as Chairman. Other members include Dr. Nsikan Nkan, Honorable Commissioner, Ministry of Finance, Dr. Mrs. Ofiongo-Four, Honorable Commissioner, Ministry of Agriculture, Engineer Kamilu Zumo, Honorable Commissioner of the Ministry of Trade and Investment, Dr. Inia Diakban, Honorable Commissioner, Ministry of Women Affairs and Social Welfare, as well as Prince Godwin Tugude, Chairman, Akroima, and Mrs. Enobong Okpongpong, Secretary, State Cares Steering Committee, who also serves as Head, State Cares Coordinating Unit. The first activity of the AK Cares was to undertake the training of all staff and personnel involved in the execution of the project. At the training, the Honorable Commissioner, Ministry of Economic Development, enjoined staff to be diligent in carrying out their functions in the field.
The success, the overall success of this program depends on you, the field officers. You have to help us. We have to make sure while in the field implementing this, things are done correctly. The IBA, Independent Verification Agency, whenever they come, they can give us, a pass mark.
Such training was replicated in the 5 basic platforms that make up the program. These are the State Cash Transfer Unit of the Ministry of Women Affairs and Social Welfare, the Akwa Ibom State Road and Other Infrastructure Maintenance Agency, Akroima, the Community and Social Development Project, CSDP, FADAMA, and the Micro, Small and Medium Scale Enterprises Scheme in the Ministry of Trade and Investment. Under the 5 platforms, interventions are to be implemented in 9 distinct areas or disbursement-linked indicators, namely social transfers to the aged, physically challenged, chronically ill, widows, and urban poor.
My governor, because he do faithful something for my life. He changed my life. He changed my child life. He changed my village life. God bless in Jesus' name.
I'm ready to work and I started to do. I'm staying safe. I don't do better because of trade. Because throw something they do for me.
Labor-intensive public work fair. Livelihood grants to economically active household members. Basic service infrastructure to community and group investments. Agricultural inputs and services. Labor-intensive agricultural infrastructure, agricultural assets for production and mitigation of food loss and waste, upgrading wet markets to function effectively, extending conditional grants to MSMEs to cover up to 50% portion of monthly operations. Each of the platform was to provide the intervention to a set number of beneficiaries. Each DLI was also given intensive enrollment training programs. After the trainings carried out on each platform, the delivery platform set out to the field to achieve their objectives. The Cash Transfer Unit, Ministry of Women Affairs and Social Welfare, also known as DLI 1.1, was charged with reaching the aged, the physically challenged, chronically ill, widows and urban poor individuals, This DLI successfully made periodic transfers, verified and sensitized beneficiaries and key stakeholders. Under DLI 1.2, the Akwa Ibom Road and Other Infrastructure Maintenance Agency, ACROIMA, the beneficiaries from poor and vulnerable households provided social work services in communities and were paid for the work to address the loss of income experienced by laborers during the COVID-19 pandemic lockdown. ACROIMA carried out this disbursement-linked indicator by validating and enrolling beneficiaries, orientating them on how to register on the platforms, 1,560 beneficiaries were deployed to 527 work sites across the state with work tools and equipment. They included male, female, youth, and people living with disabilities.
6 family hall is equal, so sometimes
people clean the place regularly, and I know at least the name of one of those people.
The Community and Social Development Project, CSDP, under the Ministry of Economic Development, implemented 2 of the 9 DLIs. Under DLI 1.3, the CSDP provided livelihood grants to economically active household members, while under DLI 1.4, it provided basic service infrastructure to community and group investments. 394 beneficiaries, both male and female, were enrolled under DLI Result Area 1.3 and given soft skills development training and empowerment to rejuvenate their businesses. Basic service infrastructure in which communities are assisted to complete and utilize functional micro-projects was undertaken in 5 communities in Esienudem, Ibesikbo Asutan, Onna, Uruanam and Urofongoruko local government areas.
The milestone of the drilling of bore, which we have done it, sanction is already done. And disclosure board, which the depth of the water is 180 depth, and the tank stand base 4 feet depth. So we even passed the milestone because of the perimeter fencing that we are just ongoing now, and the generator's house.
Health center. I mean, take care of our time. Many messages you can come for you don't. What did I do? I want to make it out the health center. You don't pay it. But I work with a woman wanting to be managing. I could have noise.
FADAMA carried out interventions under 4 delivery platforms supervised by the Ministry of Agriculture in Result Area 2. In Area 2.1, FADAMA intervened in the provision of agricultural inputs and services. Farmers who are members of farmer cooperatives are given and expected to utilize agricultural inputs and services. In Area 2.2, FADAMA intervened in providing labor-intensive agricultural infrastructure to assist farmers access and utilize these improved agricultural infrastructures to enhance agricultural production. In Area 2.3, FADAMA intervened in the provision of agricultural assets for the production of small-scale primary processing to mitigate food loss and waste. In Area 2.4, the intervention was in the upgrading of wet markets with water and sanitation service to ensure that these wet markets function safely. Under Area 2.1, a total of 730 beneficiaries have been reached, while under Area 2.3, a total number of 810 beneficiaries have been reached, bringing the total number of beneficiaries to 1,540 across various enterprises. Currently, sales of poultry beds are ongoing at the different farm locations, and the farmers are happy that their businesses have been revived.
Jesus Christ. Makenendo beneficiary kempo government in army. Na income obasi no government. Na iti ikpon efuno one, abi pa funo one demi. Inkene no unenemi. So with this union, I'm sure I'm yara kanda.
Come the state governor, His Excellency Udom Emmanuel, Kenye, he coordinate with the World Bank, ne Nampam, ne Arikan, Angwamagu, because of the effect of COVID-19. I believe that Kejin Metangwang, if I been from Nidia, I mean, even a kibok, the replica effect, I have okay, and by the grace of God, Ufuro, I have dog. You don't get them. The community them,
Some poultry farmers have sold off the initial stock and replenished their farms with even more than the initial number of day-old chicks that were given. Coordinates of roads, geo-survey and design have been completed for 14 roads. However, 7 roads have been graded and sanitary facilities have been provided in 10 wet markets located in 6 local government areas. The activities of the Ministry of Trade and Investment, working with the Bank of Industry, BOI, in Result Area 3, DLI 3.2, included enhancing capacity and recovery of micro and small enterprises by extending conditional grants to MSEs to cover up to 50% portion of their monthly operational costs.
Like we know, the NG Cares program has a couple of what we call disbursement platforms, and there are different streams to touch and intervene a couple of populations. This population, this stream, which we call the Result Area 3.2, is targeted at micro and small enterprises, essentially to make them recover from issues from the negative downturns they had during COVID. The lines in this direction